I'm very appreciative of my social work background. And many of my colleagues today who I refer to and who I respect as therapists, their training is in social work. They went on to get an MSW, a Master of Social Work, and some of them are gifted therapists, some of them are gifted psychoanalysts. And I think the contribution that social work makes to the field of therapy is understanding the role of culture, the role of poverty. Stop trying to fix existential issues. You have to first make sure a person has food, clothing, and shelter. So it gets down to very basic needs. And I think social work help ground me into understanding that. The second thing a social work training taught me was the importance of interprofessional collaboration. As in social work training as an undergraduate, we were always taught the importance of pick up the phone and call the pediatrician, pick up the phone and call the caseworker, pick up the phone and call the teacher, pick up the phone and call the Boy Scout leader. We want to get a full picture of this child or adolescent. And so I'm very grateful to that training.
The person who's not living in the ghetto, the middle class person who grew up in a middle class neighborhood, when they go to see the MSW versus the psychologist, what will the difference in the therapy be?
Practically none. In many cases, practically none. I'll talk a little bit about potentially what the differences could be. But if you're looking for a therapist, a psychotherapist who is trained as a psychologist versus a psychotherapist who is trained as a social worker versus a psychotherapist who's trained as a counselor versus a psychotherapist who's trained as a psychiatrist, conceptually, there could be very little difference. It depends on the intensity of the training they had and the supervision they had. Now, having said that, what differentiates psychologists from social work and psychiatry is psychologists tend to have more of that research background. We tend to have been trained in what they call the scientist practitioner model. I think probably more than social workers and psychiatrists have. So we have a little bit more of a research bent, I think, a little more of an understanding of research. There is another area that psychologists do that social workers and psychiatrists don't do, and that is psychological testing. Psychologists, all psychologists in our training, were trained to do what we call psychometric or psychological or psychoeducational evaluations. And they can involve IQ tests, personality tests, memory tests, perception tests, neuropsychological testing, which is a specialty now of psychology. So testing and psychological evaluation is unique to psychologists, and social workers and psychiatrists typically do not get those trainings. So that would, I think, differentiate psychology from social work and psychiatry. However, back to the issue of therapy, I personally know psychiatrists and social workers who I am equally comfortable referring my patients to because I know their training in psychotherapy and I trust it.
Does the psychiatrist have more of a, he's the only one who can prescribe drugs, but
yes,
is he more likely to think I can fix this with drugs as opposed to talk therapy?
You're asking such good questions.
Thanks.
So that's really a hot question. And the answer is, of course, it depends. But traditionally, psychiatry is a field of medicine. So to become a psychiatrist, you first go to medical school, and then you do an internship and a residency. And the residency is in psychiatry. And then, of course, you have the option to do additional residency in child psychiatry. And then there are subspecialties in psychiatry, which we can talk about later. But the primary background is medicine. So they are trained as physicians first. and then they go on to specialize in psychiatry. Traditionally, psychiatrists were known for their deeper understanding of more severe forms of mental illness that clearly have a brain-based component to their presentation. So psychotic behaviors, schizophrenic behaviors, bipolar conditions, certain conditions that we believe are brain-based. And psychiatrists have a tremendous amount of training in what we call psychopharmacology, which is the use of medicines and drugs to treat mental illness by changing and improving and balancing neurotransmitters in the brain. Traditionally, psychiatrists are the most skilled in treating what I would call severe mental illness, where there is clearly a brain basis for the condition. Psychotherapy is something that some psychiatrists trained in recent years almost have no training in, sadly. So here you can graduate medical school, you can do a residency. I'm sure if psychiatrists are watching this, they're going to throw pies at me right now. But psychiatrists, more recently trained psychiatrists, sadly to say, are more trained in the biological pharmacological models of psychiatry, and they're very good at diagnosing a condition and prescribing a medicine. There are a subgroup of psychiatrists who are also superb psychotherapists. And these are psychiatrists who, out of their own personal interest, have said, you know what, medicine is great, I think it helps, but people need therapy. So they have gone on and gotten advanced training in psychodynamic therapy, like I have, and cognitive behavioral therapy, like I have. And I would say they are equally skilled in psychotherapy. So you have to interview the psychiatrist to understand what their theoretical orientation. There are some who call themselves biologic psychiatrists. All they're interested in is doing a very thorough diagnosis and trying to come up with a medication that could help. There are others who are trained in more psychodynamic psychiatry, and they're trained in Freudian, psychoanalytic, psychodynamic, cognitive behavioral, existential, etc. So it really involves, for the patient, a very careful interview of the provider they're thinking of going to so they find a good match. So psychologists and social workers all can be trained in psychotherapy. The important question is, what was their training? What was their supervision? Those are the key questions to ask.